Hi, this is Jill, Healthcare IT Specialist with Easy Tech Compliance, collaborating with KMC University to kind of help out with some of those help desk questions. One of them that we are getting a lot of is AI compliant, HIPAA compliant? And that's not an easy question to answer because AI can be used for everything. But what we're going to focus on this help desk question is within the healthcare clinic with integration with our electronic health records. We know some of the programs are actually adding on these services. Sometimes it's a beta test, and it's an actual true service that you can add on to your electronic health records. And they're commonly used in chiropractic clinics right now. So a lot of people say, well, and they're saying it's HIPAA compliant, so it's got to be. And I just want you to think about, first of all, what AI is. And sometimes when we're tracking protected health information, because that's our job as covered entities, providers, you got to protect it. But before you can protect it, you got to know where it is, where it resides, where it's transmitted, and what's happening to it. AI technology involves the use of computer algorithms. So if you can imagine, mass data of these algorithms is analyzed, and these create these models to problem solve, to do what our human brains do. But in order for these models to actually work, all those algorithms requires enormous amount of data. So if we're putting in the patient data in there, we've got to know where it's stored, transmitted, processed. That's your responsibility. So the question is, when it comes to AI, is the use of the minimum use. Remember that whole thing, we always hear that, use the minimum amount of PHI for the intended purpose. How do you do that with AI when it's mass amounts of data? So this is what we do know. We do know that HHS only has put out a final rule that focused on vendors, those who are software developers for electronic health records. That started in 2025. And so what it said is, hey, you're going to have to disclose to covered entities. The vendor is going to have to disclose to doctors all the technical information, all about how they're using the information, the performance, the testing, the security. So they're going to have to explain the steps they've taken to manage all the potential risk of adding that cool AI service to the electronic health records. So if you have a vendor that's added this service on, more than likely they gave you an updated business associate agreement. I hope they did, because more than likely there's new threats and vulnerabilities, and they would want to include that language into their business associate agreement. They also might give you a statement. You deserve one to know how they've implemented HIPAA protections. So again, getting that tangible evidence that they're HIPAA compliant and enabling those safeguards. Another thing to think about is, does it use DSI, which is called Decision Support Intervention. So if they're using that service, you really need to know how it's being used and whether it's HIPAA compliant. Just because a vendor that we've been using for a very long time is HIPAA compliant, we have a signed business associate agreement with them, does not mean all the services they now offer are under that umbrella of business associate agreements. It may not be included. So we've got to confirm that. And then always think about this way. If you're going to use any type of AI, I'm not going to give you a list of recommendations. HHS has not put out anything yet for providers. Hopefully it will be in the new security rule. But just remember, get a signed business associate agreement with them. That's before you engage with anybody, and make sure you know what services are included. A perfect example is Microsoft Office 365 can be HIPAA compliant. You can get a signed business associate agreement. You can just, as soon as you sign up. But in their terms of use, they have that shared responsibility, and they say, oh no, these are the only services that are HIPAA compliant in all the products we offer, and this is what you have to do and configure. Same thing with this AI. Make sure you know it's one of the included services that fall under that business associate agreement, and also that you have configured your settings appropriately. And never forget, don't just start it. Make sure you've got some policies, protocols, and some training, and also monitoring.